The soft-legs treated with care, smooth, soft.
Έχει καφέ νεξό, αν θέλει κάποιος μπορεί να
No, soft-legs not important. No, soft-legs no. Rubber polishing, yes. Yes, silicon carbide. Okay, this should be fine. The rest we'll do it later. So, now we move to the next step. Yeah, I think this is fine. And now listen, you have the option, and we will combine the FEM technique with the 5-step technique that I present you at the beginning of the lecture. This is, we will first, because we are closing a diastema, we need to put the mylar strip first. Because the mylar strip will be the only one that will retract the gingiva and will allow us to edge and to bond subgingival. So this is what we do. We put the mylar strip. Yeah? And I will do the whole in one step until I finish. And then you will follow. So we apply the bonding agent. Yeah? 20 seconds. Before, of course, we place a cord, then we edge with phosphoric acid, and then we apply the bonding agent.
So this is primer and bond together, eh?
Yes, this universal is primer and bond together. Always. I will have to put the bonding again.
Have it like this.
I have to put it horizontal. You're producing this. The Greeks give me this. And this is the 4th step. If you did not put enough flowable, sometimes it's not enough, I will just fill it up. Yeah?
But we said we want.
Where you stop? Where the gums? When is
Where you stop where?
putting the material?
You stop, it depends. Subgingival. You normally stop.
You won't have a step there.
Yes, you will stop. You will always have a step here back up because you're going more. You're going more towards the cervical part than where the composite should start.
How you remove it?
With the scalpel, as I did here. With the scalpel. Yes. And now the last step will be enamel. It is clear? So the procedure is, my technique is based on the same. If it's just a pure diastema closure, the FEM technique is used immediately. Yeah, and the first tooth doesn't need anything special. If then I have just a class 4, I will do the 5 steps normally. First background, second dentin, third opal. I will tell you, I have told this like a priest so many times. Have you seen the priests are always repeating the things so that we keep the things in mind? So I'm like a priest now. Background, dentin, opal, FEM technique, and the second one needs to compensate the enamel, the width of the mylar strip. And that's why if it's not too wide, you will have to pull the matrix towards the palate, and we will have to separate with the finger. And the 5th step goes with the enamel. Yeah? In such a case on a patient, I would probably place A2 at the cervical third, and the second step will be A1 at the incisal area. Yeah, I will probably mix two shades so that it looks more natural. Here we have just A1, that's why I'm gonna make just A1. Yeah, so you can do it. It will take you time, so start doing it. In the meantime, I will place Nena. And whenever I do something interesting, I will speak and you can check.
When you close just the diastema, you
Yes.
use we begin with the fan,
Yeah.
and you use the fluable,
Yes.
and then
If the diastema is small, 1 millimeter, so half a millimeter per side, just flow. You don't have space for more.
if it's a little bit bigger, it's fluable, and then
It's flowable, and the flowable you make like a canoe. You put less flowable so that you have just a little bit of flowable. And then the tea, and then enough. Yeah?
Before for the contact point, you said you put it backally and bring it in.
Yes.
Έκαμε και τσάφο καβάλια, αυτό που είπα. Αλλά θυμάσαι. Έφυγε λίγο από πάνω
Sorry?
για να το ενώσει.
Yes. Exactly. If they do this color, you should make the chamfer. That was the idea. If it's 6 class 4, I will not make direct veneer. You make class 4.
Παρακαλώ.
Yeah, normally yes, unless too big. Look, here I have a hair.
Now it is cured and we hold it in the sculpture.
No, there was a hair. It's not cured. There's some hairs here. Well, it's not a hair, it was a piece of color. Yeah, so normally I will make just a third with A2. Yeah. The cervical third. Yes. No. You can try, but they lose their properties. So,
It's amazing because it gives a shiny without sticking.
okay. I cured the cervical third, and now I move the incisal third. You have to go. You can go. You're free to go.
Thank you very much. Hasta luego.
Yeah. Ciao. Que estés bien. How do you know Spanish?
My doctor is studying in Spain, and then in Madrid.
Really?
Yes.
Where? In which university?
Universidad Europea de Madrid.
Ah. And you have visited her.
Yes, already 3 times.
Really?
A few months, and next month again.
And when will she finish?
That is the first semester. Still.
Ah, it's a long way to go.
It's a long way, yes.
Yeah. Okay. Yeah, good luck. See you. Bye. Yeah, so now we're making the incisal third with the A1.
I like the spatula.
Yeah, spatula is nice. Great. You have to adapt it properly to the chamfer. Great. Same here. Fine. Yes, any space is enough. Any space. No, okay. Yes, put the floor. No. Yeah, do it. No, the floor needs to reach up to here. The floor should bring you the whole contact. Do it again. Yes. Exactly. Close it completely. It's faster, easier, smarter. Close it completely. Yes. The ethics are good. Yeah. Why? Yes, the ethics is good. It's very similar to you. Yes. Yes, you're right. Okay, we're almost ready. Fine. If you would like to have this present, you're using all my stuff. Here I have a small bubble that will fill with flow. Great.
In time, the stability of the color of the flow is the same as the normal.
Yeah.
These new flows, composites that they are like this.
Yeah, most of the new composites are not changed because the very old composites were changed. The old
Composites are the same as this one. I mean, in
now which old? Which one?
any kind.
There are many kinds. You need to tell me which one. There are so many kinds.
Be afraid of using this because of the bubbles, but now that I saw it,
There are no bubbles. No bubbles. No, there are no bubbles. Yeah, look, and here comes something nice. If you did it right, the technique with pushing, the mylar strip should remain there and you should not be able to, you should hold them all. Yeah? Now you believe me. And you should come to something like this, where you have some excess that you start finishing. Look, you see, it's quite precise. And now I start finishing. Yeah. Minimal excess. Minimal excess. What did you say?
it's minimal access.
Yeah, just hear it. Just hear it.
Even to the mouth.
Why? What's the problem? Look, the patient sits here. You need to put your fingers very close so that your movement is controlled. If you're doing it freehand, of course you can cut the lips of the patient. So the patient stays here, you put your fingers here, you sit behind the patient, and you tell the patient to open the mouth. Not close, because then you can cut the lips. You do the patient open the mouth. The lips are away. And you do it carefully. Look, I hold here. I have full control. Look my movement. How clean they are. Look. I never move more than this here. Do you see?
Minimal damage to the gums.
You do minimal damage. You don't damage the... Of course, no. You leave a big mess.
Yeah, it's
Big mess.
even if it's very
Yeah. Look, here. I do it.
because you have the cones, it's just we're not used to this kind of
But this is good work. I show you great work. So, then, scalpel and look. I'm almost done now. Yeah? It's a little bit too long. You were destroying the sockets. What do you do with the sockets? You use them too hard.
I use many. Maybe I'm too.
Yeah, and now we start. Okay. Length.